Done. Good afternoon, dear participants of International Conference. I am here to show my report about features of pyelonephritis adolescent girls. Relevance. Urinary tract infection ranks second in frequency after respiratory system infection in childhood. The prevalence of this disease in childhood remained high 24 to 32 per 1000 children and tend to increase. In the structure of UTI, pyelonephritis is approximately 60 to 65%, and the ratio of girls and boys are 9:1. Pyelonephritis. Acute pyelonephritis is an inflammatory disease of renal parenchyma and pelvis resulting from the bacterial infection. Chronic pyelonephritis is a kidney damage manifested by fibrosis and a deformity of a pylocecal system as a result of repeated attack of UTI. As a rule, it occurs at the background of anatomical anomalies of the urinary tract or obstruction. Etiology of the pyelonephritis. The most common cause of acute pyelonephritis is E. coli bacteria, 90%, and which has the largest set of pathogenicity factors. And in the childhood, there is a Streptococcus group A and B. Pathogenesis. Way of spread of infection are ascending way, hematogenous way, and lymphogenic pathway. Clinical features. Presentation of the pyelonephritis varies with the age. In the newborn, symptoms are non-specific and include the fever, poor feeding, vomiting, jaundice, septicemia may develop rapidly. In preschool and school children, the classical symptoms of dysuria, frequency, and the low in pain become more common with increasing age. Intoxication syndrome, the temperature rise to febrile digitis, painlessness, weakness, drowsiness, fatigue, lack of appetite in infant, refusal of the feeding, fever, vomiting, diarrhea, a mask of intestinal infection or acute respiratory tract, pain or abdominal syndrome. In infant and preschool children, the pain is localized around the umbilical area due to the irritation in the solar plexus. At school and adolescence, pain is marked in the lumbar region. Urinary syndrome, cloudy urine, proteinuria up to 0.1 to 1.1.5 gram per liter, bacterial leukocyturia, decline in the relative density of urine, bacteriuria. Dysuria syndrome, frequent pollakiuria, painful strangury, micturition, incontinence indicate the presence of lower urinary tract infection and a urogenic path of infections. The purpose of work are to study the features of pyelonephritis in adolescent girls. Materials and method. We conduct a survey of 28 girls in with chronic pyelonephritis aged 13 to 17 years in Penza Regional Children Clinical Hospital named NF Filato. Research result. The onset of chronic pyelonephritis in most of the surveyed refer to the preschool and primary school age from 3 to 12 years. Chronic pyelonephritis developed at the background of anomalies in the development of the kidney and nephroptosis in 21.4% of the patient. This metabolic nephropathy in 32.1%, in 53.2% of patient, pyelonephritis was combined with disease of the gastrointestinal tract in 25% with chronic cystitis. Pain and dysuric syndrome came primarily in the clinic of pyelonephritis in adolescent girls, 71.4%. The intoxication syndrome was less pronounced and was characterized by unstable subfebrile temperature, asthenic vegetative disorder, loss of appetite, headache, fatigue, emotional lability. Research result in girls with the chronic pyelonephritis, menstrual dysfunction was detected in 78.6%, the delay in the average age of menarche was 12.8 plus or equal to 0.1. A low indicator of body weight and height was noted 28.6%. Dysuric disorder in girls were usually associated with a concomitant infection of the lower urinary tract, often at onset of sexual activity. A hormonal imbalance should be considered as a factor contributing to relapse of disease. It is important to note that in adolescent girls who are sexually active, especially those taking hormonal contraceptive, complain of pain and dysuria are more common. Clinically, four variants of course of chronic pyelonephritis can be distinguished in adolescent girls. Chronic pyelonephritis in stage of stable remission 28.6%, chronic pyelonephritis latent course 17.9%, chronic pyelonephritis relapsing course 32.1%, pubertal variant of pyelonephritis due to onset of sexual activity 21.4%. Conclusion: pyelonephritis in adolescent girl in most cases 78.6% occur against at the background of menstrual disorder, inflammatory process of the genital area 42.9%. Factors contributing to the development of the pyelonephritis in adolescent girls are hereditary constitutional systemic disorder, puberty disorder, autonomic dysfunction, hormonal imbalance, local ovarian dysfunction, inflammation of the genital area. Due to the high prevalence of pyelonephritis among renal pathology in children, timely diagnosis and adequate treatment of the disease are extremely important. It is necessary to examine adolescent girl with menstrual irregularities actively and purposefully in order to identify the latent pyelonephritis, and in girl with the pyelonephritis to identify and treat property ovarian dysfunction and inflammatory disease of genital area, in this way preventing the recurrence of the disease. Thank you for your attention.